Hello, everyone. Welcome to SCube TV. I am your host, Rajni Bharara. And today on the show, I have with me a very special guest. She is a doctor. She is an MD in community medicine, and her name is Dr. Medha Mathur. Today on the show, we are going to speak with her about her journey and also about community medicine. But before, let's welcome her to SCube TV. Hello, Dr. Medha. Welcome to SCube TV.
Thank you, Rajni, and thank you for this opportunity. And I'm so blessed to be here and talk to you and talk to your audience.
I mean, of course, we are so excited to have you, and also, thank you for taking out time and coming to the show. So, like I mentioned in the beginning, that we'll be talking about community medicine, and so basically, in this episode, Doctor, like I've already told you, that we are going to dig a bit deep into community medicine, and we'll know the history, the evolution, and how did it begin, and where is it right now currently. So let's just begin the show without wasting any time. So, Dr. Medha, my very first question to you is if you can please talk about your journey in a community medicine. Also, how did you get into this stream and how did you explore it?
Okay. First of all, I'm honored to be here and thank you for such a great introduction, Rajni. To begin with, I was born in an inspiring family of doctors. So I always had this doctor's vibe around me since my childhood. I was born in a small town of Gwalior district in Madhya Pradesh. And
Mm-hmm.
after that, I completed my MBBS and I opted for post graduation in community medicine. And I bagged gold medal in community medicine. And after completion of my post graduation, I did my senior residency from All India Institute of Medical Sciences, Jodhpur. And after completion of my senior residency, there were like so many ways were there where I could have gone. But I opted to be a faculty in community medicine, and I am currently working as assistant professor in Gitanjali Medical College and Hospital at Udaipur. It is one of leading medical college and tertiary care hospital in southern Rajasthan, and I'm working as a faculty here. And I have special interest in community medicine. It was my branch of choice, definitely. And I have special interest in medical education also, and I have published so many papers in community medicine, public health, and medical education. So
Mm-hmm.
till now, I have like explored this particular branch, and I recommend this branch to so many undergraduate and postgraduate students. And
Mm-hmm.
it definitely has a large impact on the community, on the society. But it is
Mm-hmm.
very, I must say, a very under like. I would like to say that it is not that much discovered branch till now.
Mm-hmm. Mm-hmm. Okay, okay. But Dr. Medha, you spoke about your journey with community medicine. So now I actually would like to know about community medicine a bit. So, my first question about community medicine to you is if you can please talk about the differentiation between community medicine and other branches of medicine. So, how is it different? And how is it special and how is it more effective than others?
Thank you, Rajni, for asking this question because this is the question I'm facing for so many years. The people ask me, Madam, what is your specialty? What do you treat? Are you a doctor of heart or a kidney? Or do you
Mm-hmm.
treat tuberculosis or do you treat diabetes? But my always I answer like that we are not into the treatment business. We are into the prevention business. I would like to tell you that the name of community medicine is preventive and social medicine. In approximately 1970, the name of public health was changed to community medicine, and in some parts of the country, it is still called as preventive and social medicine. So, as the name
Mm-hmm.
itself is suggesting that we deal with the prevention more than the
Mm-hmm.
treatment. See, treatment is a very integral and important part of health. But if we focus more upon the preventive part,
Mm-hmm.
then the quality of life can definitely be improved. And in
Yeah.
community medicine, we always talk about the holistic health. So we do not only talk about your treatment part or whatever you are currently having problems in the treatment of those problems. We talk about a healthy mind and a healthy body in a healthy environment. So we
Okay.
deal with a healthy mental health. We deal with a healthy body in form of its physical health, and definitely we deal with the healthy environment in which a person is residing.
Mm-hmm.
To explain community medicine, I always tell people a small story, and I would take a 2 minute or two to tell you that story.
Of course, of
Uh,
course. Yeah.
and the title of the story is "What's Wrong Upstream." So
Okay.
actually, there was a beautiful mountain, and on the base of the mountain, there was a beautiful village, and there was a
Mm-hmm.
beautiful river flowing from the mountain to the base of the mountain. People
Yeah.
used to enjoy in the base of the mountain. There was a village, and people used to enjoy the beauty of the river, beauty of the mountain, everything. Suddenly, one day, what happened that some people were coming from upstream, and they were drowning. So people
Mm-hmm.
started rescuing them. Some of them died, some of them survived, and it kept on happening for so many days. And people were just focusing on rescuing the people. Then somebody thought that what is wrong upstream? What is happening
Mm-hmm.
wrong upstream? Let's go and see. When he went upstream, he saw that there was a broken bridge, and people were falling there. And
Mm-hmm.
because of that, the people were coming down in the river stream, and they were like drowning. So he tried to fix that bridge, and everything fall into place. So this is
Okay.
what is happening in our community, actually in our society. This is what is happening. We are so much focused on the treatment that
Mm-hmm.
we do not want to think about the prevention. See, you
Mm-hmm.
look at the current scenario of COVID. We
Yeah.
Everybody is talking about prevent COVID. Okay,
Mm-hmm.
but still the people are not taking it seriously. They are not wearing masks. They are not taking preventive
Yeah.
aspect. That's why they are
Mm-hmm.
falling sick. So if we take good care of the prevention of any disease, it will not happen. And even if it happens, it can be detected at an early stage, so that the treatment will not be so difficult and the results will be better. So
Mm-hmm.
the whole gist of community medicine is about the prevention.
Mm-hmm.
And
Okay.
prevention is, yeah, please.
Yeah. So, Dr. Medha, before you tell more about community medicine and about prevention, I actually would like to say that would you say that community medicine is actually a modern term for yoga?
See, if you call it yoga up completely, you cannot define community medicine as yoga. Yoga
Okay.
can be taken as a part of that thing. Okay.
Because yoga also somewhere it actually treats a person from the roots, and it actually sees the root. I mean, the problem that is in the root, so it checks it. I mean, it actually goes into the roots, and it prevents the disease, like you said, in community medicine it happens, and also it takes care of the mental health too. So yeah,
Yeah,
so you were
definitely.
saying.
But I'll still stick to my answer that this is just a part. Public health or community medicine is a very wide thing. It is
Okay.
usually said that whatever is under the sun is under the public health. So it has a very wide range. It starts from a child, and it ends at it never ends, actually. It covers the
Mm-hmm.
elders also, it covers the adolescents also, it covers everything. If you must have heard about so many national programs going on in the country, like Jani
Yeah.
Suraksha Yojana,
Mm-hmm.
reproductive mental and maternal child health programs. All
Mm-hmm.
these programs, they are under public health, and they are being like formulated, and they are being implemented by public health experts. So
Mm-hmm.
we take care of everyone. We take care of a person right from the childhood to the death. So everything comes under community medicine, or to call it as public health. And yoga
Mm-hmm.
is definitely very important, I won't deny that, but it is definitely only a part to
Okay.
keep yourself healthy, to keep yourself on the track, and keep your immunity high. So that I would call it as a part of it.
Okay, so you would call yoga as a part of community medicine, but not the overall thing.
Yeah.
Okay, okay. But Dr. Medha, also, I would like to know that, you actually mentioned about about community medicine actually curing everything, every disease that comes under the public health. So would you say that community medicine, in comparison to other branches of medicine, is given as much credit as it needed?
No, definitely not.
Okay.
We are definitely lacking there, and reasons are enormous. Just I
So
cannot
please
just.
mention few reasons. Please mention few reasons.
So the first thing is that the people do not understand the importance of this particular subject. This is the most,
Hmm.
I guess, is the most important and the big reason. And other
Okay.
thing is, even in the medical fraternity, it has not been given so much of importance in India and in the developing countries. In comparison to the developed countries,
Hmm.
they take prevention in a very serious manner, but we
Yeah.
take treatment in a very serious manner. We want to fall
True.
sick, then we will get treatment, and then we'll be
True.
happy. We do not
True.
want to prevent the disease before it comes. So
Yeah.
there is a difference in approach and attitude. That is the basic
Hmm.
problem we are facing.
Hmm.
That is basic reason, I guess.
Okay. And also, because we, especially in the developing countries, especially in our country, I think we have this mindset of हमको तो नहीं होगा.
Yeah, exactly. This is what we
So
think.
yeah, yeah.
And
So
this is
the other person might get it, but we will not get it. So with this mindset, when we go, so we obviously will not be taking care of the prevention, but we'll be taking care of the treatment. So
treatment
which is,
always.
yeah, which is, I think, the major area that we need to change our mindset of.
Yeah. And
Yeah,
that will only happen when we will start thinking about the prevention first. See,
yeah,
this is
definitely.
what is happening with the COVID situation
True,
right now.
true.
People are not taking things seriously. They want, let's go party, let's go for,
Yeah.
say, घूमने चले जाते हैं, etc. They don't want to
Mhm.
be at home. They don't want to follow social distancing. They don't want to wear masks. So this is the
Mhm.
basic problem we are facing.
Mhm. Absolutely. And also, when it comes about and not just the prevention part, I mean, not just the part about, social distancing and, managing a distance and not going outside, cutting down on travel. But also, I think when the government is providing you vaccines, even then, they are not agreeing to take their vaccines.
Yeah,
Uh,
definitely. A lot of vaccine hesitancy has been seen even in the
True.
healthcare workers. They themselves are were not ready to take the vaccine. But
Okay.
during the second wave, when it was seen that those who were vaccinated were not getting infected or were getting
Mhm.
very few symptoms, then only people
Mhm.
started taking it seriously. Now you are
Mhm.
getting the point here that people were afraid of the severity of the disease. They were not afraid about the preventive part. They were
Yeah.
afraid about the severity of the disease. That's why they started taking the vaccine. So this is the difference in the attitude. So first, the
Mhm.
attitude should be changed, and that can only be changed by giving, by setting good examples. Then
Yeah.
only it will work in a country like India.
Yeah, absolutely, absolutely. So, with this, doctor, I would like to, move to my next question. Also, so you actually mentioned that you work for the overall health of the individual within the home environment and within the community. But so, how to detect whether you have a normal fever or you have got a severe virus inside you? So, how to detect this, within the home environment and the community environment, and also how to also treat it then.
Okay, so first of all, I would like to tell that you should never treat yourself. Don't be your own doctor. Always
Okay.
seek help from a medical personnel. And
Okay.
if in current scenario when we are having a situation of COVID-19 pandemic, even if you are
Mhm.
having mild symptoms, the first thing that you should do is to seek medical help. You should go to
Mhm.
doctor and ask for help. And
Mhm.
because at times what is happening that you are not aware that you might be positive for COVID-19, and you are coming in contact with your family members, with your friends and others, and you might
Mhm.
spread the disease.
Yeah.
So if you are having any flu like symptoms as we are listening for so long, then you should get yourself tested. You should seek medical help, and
Mhm.
then only if it comes out negative, then you should take medicines at home and stay
Mhm.
at home. Otherwise, it is always advised that you take medical help.
Okay. 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 So, but then how to actually detect it, that whether you have normal fever, cold, or cough, or these things, or whether, you have got a severe virus. I mean, not just COVID, but, any virus. So, how to detect it?
So basically, the severity and the grade of the fever is
Mm-hmm.
usually a good indicator that if you're getting high grade fever, then you
Mm-hmm.
should be a bit alert. And if
Mm-hmm.
the most important thing is the contact history. If you know that you have come in contact with someone who was having the infection or was having some other kind of disease, and you have come in contact with that person, so that is a major indicator. So you just
Okay.
go back, think about it. Have you been in contact with a person? And at times,
Mm-hmm.
it is also associated with gastrointestinal infection. So if you have eaten outside, or if you have drink some kind of water outside which was not good in quality,
Mm-hmm.
then also you can think about it. And rest of the symptoms, most of the symptoms are common in viral illnesses. So it's very difficult
Mm-hmm.
to detect at say home at the level of the home.
Okay. Okay. So it's better to get yourself tested and
Yeah,
get yourself. Okay.
that is very important. First you
Okay.
take precaution, first you try to prevent the disease, but if it happens, then you should, it's always advised to go and seek the medical help.
Okay, all right, all right, great. So now, moving on to my next question, Dr. Medha. So, what to do on a regular basis at home? What to do in order to, like, you talk about prevention in community medicine. So, what to do at your home level on a regular basis to, to prevent any disease, or, if you can please talk about a few steps that one should follow that people are not generally aware about to
Okay.
prevent a disease. Yeah.
Okay, so general principles of prevention are usually maintaining a good level of immunity. And the most
Mhm.
important thing for having a good immunity is not taking any extra things like any jadi booty or things. It always lies in the food that you eat. So
Okay.
always try to eat balanced food with all the macro and micronutrients. And the
Mm-hmm.
frequency of the food should be right. You should not be malnourished. Malnourished in the sense you should not eat too less and you should not eat too much. So your
Okay.
BMI should always be in the right range. And that is the basic key. If you have good immunity, you have correct BMI, then the chances are very less that you will have any kind of disease. And
Mm-hmm.
other important things are definitely to take to drink good quality of water. The source of water should be sanitized, and the food that you are eating should be properly cooked. It should not have any infection in it. And a regular practice of washing hands after using the toilet before eating food, and this particular thing should be like inculcated in your behavior.
Mm-hmm.
And there are certain specific steps of washing your hands that you have to follow. There are 6 steps of washing hands that every person should learn, and wash your hands for minimum of 20 seconds, and
Mm-hmm.
all the 6 steps should be there. So these are the basic things. And doing exercise, doing yoga, definitely it enhances your lung capacity, your general immunity, and it keeps
Mm-hmm.
you in shape, it keeps you fit, definitely. So all these things are definitely important
Mm-hmm.
to be healthy, and these are important so that you will not get any kind of diseases. And one more important thing I would like to tell, that nowadays we are having non-communicable diseases, which are also
Mm-hmm.
called as lifestyle diseases. So because all of us are having such a sedentary lifestyle, even the doctors, teachers, everyone is
Mm-hmm.
having such a sedentary lifestyle that you get disease just by sitting. So
Okay.
you should have a very active lifestyle. Even if you are having an office job, or you are sitting for 6 hours in a day in your office, or you are having a table job, then make
Mm-hmm.
sure that you do some exercise either in the morning or in the evening. So
Mm-hmm.
that is the basic way of avoiding lifestyle diseases. So most common
Okay.
lifestyle diseases that we are having nowadays are stroke, hypertension, diabetes. They are so common. Even in the young population, we are seeing them. And
Mm-hmm.
there are so many national programs are also going on against them under the purview of public health. So that is another thing that you should be aware that what you can get. and age is not a bar for that.
Yeah.
So these are all very important things that a person should take care about.
Okay, okay. But also, before moving to my next question, I would like to know from you that what are the major diseases that, community medicine is currently working upon?
Okay. So as I told you, anything that you can think of, we are working on that. So all the
Okay.
infectious diseases like tuberculosis, HIV, all the infectious diseases like respiratory infections, chickenpox, measles, diphtheria, pertussis, tuberculosis, I already mentioned,
Mm-hmm.
leprosy, all these diseases which can happen to humankind, we are dealing with them, and there are so
Mm-hmm.
many national programs going on against them. And as you must be aware that we have eradicated polio from India in
Yeah.
2014, and we eradicated so many other diseases from India, and it was because of the efforts of the public health people only. Like smallpox, it
Mm-hmm.
was eradicated in 80s, and you are aware about the polio and
Mm-hmm.
worm disease. There are all these diseases, we have like eradicated them completely from the country. And
Mm-hmm.
non-communicable diseases are also there, as I mentioned about diabetes, hypertension, stroke. And one very interesting thing is road traffic accident is also considered as a non-communicable disease. So there are factors which like causes these road traffic accidents. So if you make people aware about them, if you take care
Mm-hmm.
about make them aware, if you take care of the roads, if you take care of your vehicle, if you take care that you're not drinking while you're driving, you're following the rules, then all the RTAs or road traffic accidents can also be inhibited or can
Mm-hmm.
be prevented. So there are so many programs, and one very important thing is vector-borne diseases. Vector-borne diseases comprises of malaria, dengue, and chikungunya. So all these diseases which can be easily prevented because they all are mosquito-borne diseases, vector-borne
Yeah.
diseases, as I said. So if you inhibit the say breeding of the mosquito, then these diseases can be easily inhibited or can be prevented. So all these
Mm-hmm.
diseases, all these things, and I would like to tell you that the biggest program in the world was a revised National Tuberculosis Control Program, which was run by WHO. And
Mm-hmm.
now we are in another phase of tuberculosis elimination. Now it is called as NTEP, National Tuberculosis Elimination Program. So this
Mm-hmm.
is the biggest program of the world, which was so successful in India, and it was
Mm-hmm.
because of this reason that we implemented it so well. The policy was made so nicely that in 2025 our prime minister has said that we should get rid of tuberculosis completely from India. So all
Mm-hmm.
these things, all these diseases, and not to forget about the COVID-19 pandemic. This is the burning topic, and you must be knowing that all the strategies which are being made at the level of central or in Niti Aayog, the people from the public health are sitting there who are making these strategies, who are making these programs, and
Mm-hmm.
implementation of program is also being taken care by these people only.
Okay, I mean that's really, really amazing, and that's really great. You're working towards so many, I mean, eradication of so many diseases, which I think needs to be done. So, thank you so much from on the behalf of the people. So, but also, Dr. Medha, I would like to know from you. So, do you think your sector is getting enough support? I mean, actually have already spoken about the credit, but I would like to talk about support here. So, do you think that your sector is getting enough support from the people of our country and also from the government? And if not, what more would you like to, would you like in your sector to happen for to grow?
Yeah. I would not say that we are not getting enough support. We are definitely getting support, but the amount of support which is expected for doing such a huge amount of work is definitely not sufficient. We are getting
Okay.
support, and we are more support will always be welcome. So one thing is this. Another thing is the due recognition is important.
Yeah.
Okay. So what happens that everyone, when they realize that yes, prevention is really important, so other people also come into play.
Mm-hmm.
And this is really incredible that people do understand the value of other the department, other people from other faculty, they do understand the value of important of prevention, and they come along and they play with us. Definitely the government can make special cadre for us, and definitely there can be some special courses for the people who are interested in doing special research. So all these things can be done at the level of government. And
Mm-hmm.
one more important thing is that public awareness is really important regarding
Yeah.
this particular subject, regarding this particular area, which is really
Mm-hmm.
lacking. So I don't know
Mm-hmm.
when the day will come when people will stop asking me, what is your specialty? What do you treat? That will be
Mm-hmm.
like my shining day. I'm waiting for that day.
That's really amazing. And we hope that that day comes soon, because we are doing our bit to educate the audiences. So, and now we are hoping the day comes soon, and you and your team and your sector get enough credit for the kind of work they are doing, because it is a major, major thing that they are doing for the humankind. Because other sectors get enough credit and other people get enough credit for what they are doing, but public health and also community medicine is actually taking care of the prevention, which is, I think, the most important thing. So now with this, I would like to move to my next question, Dr. Medha. So my next question is it possible for people to diagnose a disease at home? And if yes, then what specialties does it require?
Okay, so if we talk directly about the diagnosis, I would say a lot of expertise is required for that, because a person enters the medical school, completes his PG, then only he becomes capable of diagnosing the disease. But if we talk about the community level, there are
Yeah.
so many things which can be taught to the people in the community so that they can detect the disease at an early stage. I would not call it as the complete diagnosis. The detection
Mhm.
can be done. It is a very important part of primary prevention, primary and secondary prevention, where early detection is done. So, for example, if we talk about cancer, okay, so let's take an example of breast cancer. So, there is a technique of self breast examination.
Mhm.
We go in the community and we teach females to do the self breast examination. That is a technique that can be easily taught to the females, okay, and we tell them to do this on their own self. And if they feel any kind of lump, they can come to the doctor, and then the disease can be, or the cancer can be diagnosed, okay, it can be
Mhm.
diagnosed or can be ruled out. So this is one
Mhm.
way that you tell people that you go for self breast examination or certain kind of things, okay. Another
Mhm.
important thing is like telling people about the signs and symptoms of some disease. For example, if a person is having a positive family history for, say, diabetes mellitus, then we tell that person that if you ever feel these signs and symptoms, you should get your blood sugar tested. And
Mhm.
at very larger level, a screening program can be done for people who
Mhm.
are, say, 40 plus. So their diabetes and hypertension can be diagnosed in large screening programs. For
Mhm.
example, hypertension, there is a very simple technique that if a person takes blood pressure even by a digital machine, he takes three readings, and if they are continuously coming high, then a person can contact a doctor, and then the disease like the hypertension can be diagnosed or ruled out. And so all these things are there which we can make people aware about, so that
Okay.
if it happens to them, or if it happens in their community or surrounding, it can be detected
Mhm.
at a early level, or early diagnosis can be made. I'm emphasizing again and again on the early diagnosis, because the time of diagnosis decides the outcome of the disease. If it is diagnosed at an early stage, the outcome of the disease will definitely be different. And it
Okay.
is true for all the diseases, for the infectious diseases, for non-infectious diseases. So this is what can be done at the community level. So for this,
Okay.
again, health education plays a very important role, and the
Yeah.
motivation of the people who are doing this health education is also very important.
Definitely, definitely. So, last but not the least, before I let you go, Dr. Medha, I would like to know from you a bit about, what can we expect from the third wave?
Mm. Okay. So, as we all are aware that third wave is knocking on our door. So,
Yeah.
what is happening actually is we are trying to survive. The way we are trying to survive by making certain changes in our attitude. We are wearing masks and we are like following social distancing. We are not going out. These are our changes that we are doing at our level. Similarly, the virus is acting smart. He is also making certain changes for his own survival. So he
Mm-hmm.
is mutating itself. Now we are aware that so many new strains, variants are available there, are already there in the community. So if it comes back with a new variant for which we are not ready,
Mm-hmm.
then it can definitely affect us. But the positive part is that a large number of people in our country and
Yeah.
okay. So as I was telling that as we are changing ourselves, we are changing our attitude. The virus itself is very smart and it is mutating itself in so many variants. So
Mm-hmm.
the major problem is the new variant, but the good news is that large number of people in our country are vaccinated now. And
Yeah.
as the ICMR has given a new report that the zero positivity rate in India is quite high, so we can expect that it will not affect us too much, but we cannot predict it right now. And as the epidemiologist has already predicted that it might be a heavy wave, and depending upon the attitude of the people. So the way the
Okay.
people are behaving right now, not following social distancing, not wearing masks, going outside unnecessarily, if this will keep on happening, it's very difficult to keep the things in place. So what we can do is to follow the COVID appropriate behavior for some more time. Till then, this pandemic is there, and once the pandemic is over, we will get back to our normal life definitely. So we
Mm-hmm.
should not leave this COVID appropriate behavior of washing our hands, wearing masks, maintaining social distancing. This is what we can do. And those who have not taken the vaccine are advised to take the vaccine if there is no contraindication. As we know now, even the lactating and pregnant females can take the vaccine. So there are no any specific absolute contraindication. There are certain contraindications are there, but most of the people are being like allowed to take the vaccine. So the
Okay.
vaccine and the mask and the social distancing and washing your hands, this is the basic thing that can save us from this third wave. So this is
Okay.
what we are supposed to do.
Mm-hmm. So the basic safety that was
Yeah,
told earlier in the first and the second wave, we just need to follow those guidelines, and then
yeah,
it probably help us. Okay.
yeah.
Thank you so much, Dr. Medha Mathur, for coming to SQ TV and speaking with us. It was so lovely chatting with you. It was a great, great conversation. Such an informative conversation that we need to educate our audiences about. So thank you again for being on the chat.
Thank you, Rajni, and it was really nice talking to you. And I really felt so good talking to you. I really felt that we are really doing something good for the community and for the country. Thank you for giving me this opportunity, and thank you, SQ TV.
Of course. Pleasure is all ours.
Thank
Thank you,
you.
guys. Thank you, guys. Keep on watching SQ TV and do subscribe to the channel.